On this Wednesday night, restricted access. The border between Canada and the U.S. closes to all non-essential travel.
We're encouraging people to stay home.
Who's still allowed to move? Plus, how Trudeau got trumped by Trump. Canada's $82 billion rescue plan.
We have the fiscal room to do this.
How the emergency dollars are being divvied up and how to apply for help. In dire straits.
The first question is like, are we going to bankrupt?
The crisis for thousands of workers and business owners. And medication recommendation, what COVID-19 patients should avoid.
Global National with Donna Friesen. Reporting tonight, Robin Gill.
Good evening and thank you for joining us. We begin with drastic new measures to slow the spread of COVID-19 and help Canadians get through the pandemic. The Canada-U.S. border is now being shut down to non-essential travel as officials on both sides scramble to fight off the virus. Here at home, disruptions are growing by the day, and so is the financial fallout. Today, the federal government unveiled a massive $82 billion aid package to help Canadians cope.
In these extraordinary times, our government is taking extraordinary measures. In Canada, public health should never hinge on financial considerations.
Coming up, we break down the numbers, what the government is promising, and what's in it to help you. But first, the latest from the front lines. Quebec recorded its first death today. That brings the total number of deaths in Canada to 9. More than 700 people have now tested positive in Canada. Most of the cases are in BC, Ontario, Alberta, and Quebec. BC saw a major spike today, 45 new cases, bringing the total to 231. Ontario, Alberta, and Quebec all reported double-digit increases. Elsewhere in Canada, here's where the numbers stand at this hour.
We start to see a sharp rise in cases, and a number of provinces have reported cases with no links to travel. This is a signal that there is some degree of community spread, so our time to act is now.
All the provinces are ramping up their response to the outbreak. Just today, Newfoundland and Labrador and the Northwest Territories declared public health emergencies. In BC and Saskatchewan, provincial states of emergency are now in place. A lot has changed in this country in just 1 week, and officials say it won't be over anytime soon. Here's Mike Armstrong with how the government plans to help.
The Prime Minister was beaten to the punch just an hour before Justin Trudeau stepped out of self-isolation to announce the historic closure of the Canada-U.S. border. The U.S. President took to Twitter, Donald Trump tweeting out that the two countries had agreed to shut down the border to non-essential traffic.
Travelers will no longer be permitted to cross the border for recreation and tourism.
Now, there is a concerted effort by both governments to ensure commercial trade continues to flow. Truckers, for example, are exempt. When the U.S. closed its border to China and then later to Europe, it did so unilaterally and without warning. The closure with Canada was negotiated and mutual. Keeping supply lines open is too important to both countries.
There was not even an atom, a molecule of pushback on that.
The other major announcement was the COVID-19 Economic Response Plan. There are two parts. There's $27 billion in direct support to Canadians and $55 billion in tax deferrals. Together, that's about 3% of the country's GDP and a massive dent in the federal budget.
Usually my job is to ensure that we maintain our fiscal track. But right now, as Minister of Finance, my only job is to make sure that Canadians can keep food in the fridge.
Now, the goal is to help the people who need it most. There's an emergency care benefit for people who don't have access to paid leave. That's about $10 billion. There's a program to help workers who lose their job in this crisis, $5 billion. There's also a temporary business wage subsidy, $3.8 billion to incentivize employers to keep workers on their payroll. There's also support for student loans, Indigenous communities, and homeless shelters. Now, Ottawa's moving the deadline for Canadians to file their taxes. Instead of April 30th, it's now June 1st. And there's also some relief coming for people nervous about paying mortgages. The country's 6 biggest banks have agreed to allow personal and small business customers that have to defer mortgage payments for up to 6 months. Robin?
Mike Armstrong in Ottawa. Thanks, Mike.
Thank you.
The emergency fund is aimed at helping Canadians pay for groceries and rent and to help businesses meet their payroll. Abigail Bimman shows us who's eligible and how Canadians can access the aid.
This Ottawa bookstore closed its doors but is shipping out care packages.
They say if they like mystery books or fiction, history, whatever, and we have a surprise package and we drop it off at their place.
But the owner still had to put their dozen staff on leave and have had trouble getting through by phone to the right government agencies for EI help. Others report the Service Canada website is crashing as they try to sign up.
Anything would help, for sure.
Two major planks of the government plan are the emergency care benefit and the emergency support benefit. The care benefit is short-term help for those without paid sick leave, parents with kids out of school, caregivers for the sick, and people under quarantine. The government says people will be eligible for up to $450 a week for 15 weeks, starting in April. You can apply through Service Canada, the CRA, or a toll-free number that hasn't been released yet.
It will require a simple attestation that will not require medical documentation. We want this to be as easy as possible.
The emergency support benefit is longer-term help for Canadians who lose their jobs or hours due to COVID-19 but aren't eligible for EI. Details are still coming about how to apply. And for 12 million low and modest income families, there's a boost to the Canada Child Benefit and a one-time goods and services tax credit. Ottawa says these two measures combined would amount to $1,500 for a single parent with two children. The top-ups will come to you automatically from the CRA based on last year's filings. There's also a temporary payroll subsidy for small employers, equal to 10% of pay, up to $25,000 per business. And all of this is a start.
I will highlight, of course, that the Emergency Measures Act is a significant step, not one that we feel we need today, but not one that we are closing the door to in the future if necessary.
The Prime Minister considering every option in a rapidly evolving situation. Abigail Bimman, Global News, Ottawa.
The U.S. is considering a $1 trillion plan to counter the economic fallout, but it hasn't been enough to calm investors. In North America, the markets plunged again today, with trading halted briefly on Wall Street for the second time in 3 days. The Dow sunk to a 3-year low. The loonie was pushed below 70 cents U.S., a 5-year low. And the price of crude went crashing under $22 a barrel for the first time since 2002. With investors worried about a sharp drop in demand. There's a lot of volatility right now, and the U.S. and Canada are very interconnected. Jeff Semple is in the Niagara Falls region, where tourism is already taking a big hit. Jeff?
Well, Robin, the world's longest undefended border is also one of the busiest. A couple 100,000 people cross the Canada-U.S. border every single day. But tonight, governments on both sides are getting ready to shut the door. This is what Niagara Falls usually looks like. Crowds gathering for a glimpse of one of the world's 7 natural wonders. But today, that picture postcard sits empty.
But right now, it's just a ghost town. It's really sad to see.
The owner of this decades-old family restaurant says March break is typically one of their busiest weeks. Instead, they've just laid off 80 staff. This is worse than SARS, she says, even 9/11. That was the last time the U.S. border was closed, and it only lasted a couple of days.
We're just hoping this ends quickly.
The government says these measures could last months, but the closure will not affect what it calls essential travel, deliveries of food, fuel, and medicine. $2 billion worth of goods crosses the border every day.
Supply chains, including trucking, will not be affected by this new measure.
But the American and Canadian governments are shutting the door on hundreds of thousands of others, including tourists like this family.
Pretty empty. Restaurants closed. The fall is still working, right?
And cross-border shoppers, such as this American stocking up on Canadian candy bars.
Coffee Crisp, #1, no Canada for sure.
We need to do all we can to contain this virus, and we don't need leisure traffic going across the border to go shopping for cheaper gas, eggs, and beer.
But the mayor says they will need financial assistance from the federal government for the many businesses and employees affected.
I hope the government comes up with something to help people.
Some health experts question whether these travel bans make much of a difference. But the economic impact is much easier to predict.
This is not going to be without suffering and pain for a lot of people, particularly vulnerable Canadians. Canadians working on hourly wage basis, gig economy. A lot of young people who don't have secure employment are on contract.
And that impact felt most, perhaps, in these border communities. Niagara Falls does about 80% of its business between the long weekends in May and September. And they're urging Canadians to do their part to help to curtail the outbreak and lessen the impact on the economy. As for exactly when this border will close, Robin, Prime Minister Justin Trudeau wouldn't give a specific date except to say very soon.
Jeff Semple in Queenston, Ontario. The World Health Organization is clarifying its recommendations on the use of a popular anti-inflammatory medication. The agency says people who suspect they have COVID-19 should not take ibuprofen, commonly sold as Advil or Motrin. Instead, they should take paracetamol, also known as acetaminophen or Tylenol, if they're experiencing pain. The WHO says it's still looking into the impact of ibuprofen, but there's concern it may make COVID-19 worse. Those already taking the drug for other conditions should not stop taking the medication without consulting a doctor. Treating the rising number of COVID-19 cases will put immense pressure on our healthcare system. And that's why you've been hearing the term flatten the curve. The goal is to do what we can to limit transmission ourselves so we don't overwhelm our hospitals and medical workers. Doctors are bracing for a surge in patients, but many hospitals were already operating at capacity before this. Eric Sorensen reports.
Humber River Valley is one of Canada's newest hospitals, as ready as any to treat the outbreak of COVID-19. But this hospital and others can only take in what they can. Italy has a top-notch healthcare system too, and it was simply overwhelmed.
Our hospital systems in Ontario and in Canada routinely run at 100% or higher. So any surge outside of our normal activity gets us into trouble. If we take the worst case scenarios, kind of like what's happening in Italy right now, we could vastly overwhelm our hospital's ability to care for everybody, especially our intensive care units.
1 month ago, there were 8 cases in this country. A week ago, there were 96. Look at how the numbers have jumped upward since then. Over the last 4 days, cases more than doubled to 597 Tuesday night. At that pace, doubling quickly, there could be 30,000 cases 1 month from now, and that is a conservative estimate. With the numbers rising then, the worry is the healthcare system's capacity. There are only so many ICUs and ventilators. If the numbers spike beyond capacity, there may not be enough facilities and care for everyone before the pandemic breaks. With precautions like social distancing, the curve flattens. Cases can rise more slowly, can be managed over time, and Canadians can count on getting the care they need.
And so if you can spread it out so that they're not all showing up in the same week, but you spread them out over many weeks or months, then that's what we call flattening the curve.
It's still relatively quiet now, but Humber River Valley expects a surge in patients soon.
We're not under any particular pressure to care for these people, but that will change very quickly as the cases continue to rise over the next couple weeks.
The experts can see what's coming.
So that's why the decision was made to act now. And so that's why, we really need everyone to exercise social distancing as best as they can.
Canadians can still make a difference, and Canada can still avert the level of crisis they're coping with in Italy. Eric Sorensen, Global News, Toronto.
So how are Canada's hospitals preparing? Coming up, the mission to make room and stock up supplies. As cases of COVID-19 increase across Canada, healthcare systems are getting ready for an influx of patients. Heather Yourex-West looks at how hospitals across the country are preparing for the weeks ahead.
In the war against COVID-19, hospitals are the front lines. And in cities across Canada, the battle has begun.
There are a number of patients coming into the emergency department with
respiratory failure due to infectious concerns is possibly COVID-19. The emergency department staff are trying to take care of them to the best of our ability while keeping protected ourselves.
For hospitals that usually operate at or beyond capacity, work is underway to ensure there is space for new patients.
Alberta Health Services is postponing all scheduled and elective surgeries. Urgent and emergency surgery, as well as oncology and scheduled cesarean procedures, will continue.
Not every person infected with the new coronavirus will need to be hospitalized, but as many as 10% could require intensive care. Quebec's premier believes his province's health system is ready.
We have already 2,300 beds that are waiting in case we need to use them for the coronavirus.
Of course, it's not just space that will be required. Work is also underway to bolster supplies and staff. In Alberta, 300 retired doctors are being asked to return to work.
We will be reaching out to those physicians later this week to ask them if they have an interest in coming back into practice throughout this pandemic.
But the fact is, all this preparation may not be enough if the virus spreads too fast. Several provinces have plans for things like field hospitals if the number of sick surge. But even with social distancing and self-isolation, there is a real threat that healthcare resources could be overwhelmed. Heather at Yourex-West, Global News, Calgary.
Still ahead, the hurdles Canadians face trying to get home. More than 200,000 people worldwide have become infected with COVID-19 since the outbreak began. At least 83,000 people have recovered, most of them in China, where the virus was discovered. While the number of new cases and new deaths dropped dramatically in China, it's another story in Italy. At least 475 people died in the past 24 hours, the highest death toll in a single day. So far, almost 3,000 people have died in that country. Iran has also marked a tragic milestone, with more than 1,000 people dying from COVID-19. Out of the more than 17,000 cases there, the government says more than 5,300 people have recovered. The federal government is urging Canadians abroad to come home as borders around the world close. But for some, that's easier said than done. Our Europe Bureau Chief Crystal Gamansing reports on the roadblocks.
When Europe closed its borders to foreigners, some Canadians became stranded.
The streets are bare and empty, and we feel pretty desperate.
Suki Faulkner and her husband were on their way out of Barcelona on March 3rd. While boarding a train, she fell and broke her hip. She had surgery but now needs an escort nurse and says she's been trying daily to get help from Global Affairs Canada.
I'm still in some pain. I don't move well. I need to be at home. My husband needs to be at home.
Canadians from all over the world are saying they need to be home. Social media is flooded with messages. The federal government is offering loans of up to $5,000 per person for flights and accommodations, but many are spending hours on hold or online trying to find an airline still flying or a hotel still taking guests. It's adding stress to the fatigue people are already feeling.
This is our first trip to Europe ever, and we were supposed to stay through till the 31st.
We met Tammy and Kevin Pollard in London. They booked a flight back to British Columbia for Wednesday after one airline canceled on them. They did make it to Heathrow with their daughter, but after security, this is what they faced: closed cafes and empty shelves.
Definitely, we're looking forward to getting on the flight and at least getting to Toronto and then ultimately back to Vancouver.
Stephen Rausch is on the other side. He's in Alberta trying to get his mom home from Morocco. Calls to the emergency helpline touted by Prime Minister Justin Trudeau go unanswered.
Our offices are closed at the moment. Please call back later.
We feel a little hopeless. We feel a little lost.
People are scared. They want to be reunited with their loved ones, and they want to know that they're safe. Given the rapid spread of this virus and all of the shutdowns, that's just not a guarantee right now. Robin?
Crystal Gamansing in London. Unemployed and uncertain. Up next, how Canadians are facing financial fears. Small businesses across Canada are facing a harsh new reality. Some are being forced to close, putting thousands of Canadians out of work. Amanda Jelowicki has a few of their stories.
It's a busy morning at Old Montreal hotspot Olive and Gormondo. But the staff isn't preparing for an onslaught of customers. They're getting ready to close their doors, unsure if they'll ever reopen.
For sure, it's very scary. The first question is like, are we going to bankrupt?
The company has 130 employees. Like so many hospitality groups across the country, Olive and Gormondo is facing a crisis. Laying off staff is the only option.
We're very afraid about that. Like, what about like paying your electricity, your rent? So a lot of questions I think people are waiting for.
Employees know finding new jobs is unlikely.
We're going to apply for unemployment, and we're going to hope that can last us for a little bit. We're going to be very careful. We have a bit of savings, but yes, it's nerve-wracking.
Canada's Federation of Independent Businesses applauds Ottawa's sweeping emergency measures, but the outlook remains dire.
We have many members. 25% of small business in Canada think that they won't be able to survive more than 4 weeks.
No, not right now.
The reality is people are scared. Young parent Stephanie Gabamonte and her husband both lost their jobs this week. Gabamonte isn't sure she qualifies for EI because she just returned from mat leave. She spent hours on the phone with Service Canada, but got no answers.
My husband, we're talking about 55% of his salary, of one salary with 2 children. We have a mortgage to pay. We're hoping that all this hard work doesn't just go to waste after this virus that's attacking us.
A virus that didn't exist just a few months ago is now upending so many Canadian lives, leaving many asking, how and when will it all end? Amanda Jelowicki, Global News, Montreal.
And that is Global National for this Wednesday. I'm Robin Gill. We leave you tonight with some levity. Students are sharing their rehearsals online with the hashtag Sunshine Songs. Productions are canceled, so the show must go online. Thank you for watching, and I'll see you back here tomorrow. Have a great night.